This is Seeking Delphi, episode number 36, The Future of Nursing and Caregiving, Part 1, with Orianna Baudette and Dan Pesut. I'm Mark Sackler. The future lives here. Many futurists, like myself, are generalists. We try to see the very big picture as far as assessing our collective tomorrows. But there is a pressing need for foresight within specific, more specialized fields, and there are dedicated futurists in areas such as artificial intelligence, aerospace, military technology, education, and especially in today's subject matter, healthcare. Orianna Baudette and Dan Pesut both have nursing-related doctorates and ties to the University of Minnesota. In this first part of a two-part series, we'll discuss the need for foresight in nursing and healthcare in general and look at the global challenges of an aging population. In part 2, we'll drill down to some specific issues and disruptive technologies, such as the impact of automation and artificial intelligence on caregiving. Here's part 1. Dan, Ori, welcome to Seeking Delphi, and thanks for joining me.
Thanks for having us, Mark.
Thanks, Mark.
Let's start with each of you giving us a little background on who you are, and I'm not going to get into the identity politics of ladies first or age before beauty, so I'm going to flip a coin, and the coin says we'll start with you, Ori.
Hi, everybody. Good morning. My name is Orianna Baudette, and I go by Ori for short. And Mark, I'm really excited to be here with you and Dan today to talk about how foresight is being used in healthcare. My background, I am a nurse by background and completed my doctoral degree at the University of Minnesota in Health Innovation Leadership. And with that, completed the design certificate and then took it a step further to pursue education around foresight. So did my training at the Institute for Futures in Palo Alto, and then did a teaching fellowship at the Future Today Institute as well.
And I might add that you, as well as Dan, are my fellow colleagues in the Association of Professional Futurists as well. Dan, how about you?
Well, good morning, everybody. My name is Dan Pesha. Currently, I'm the director of the Catherine J. Densford International Center for Nursing Leadership at the University of Minnesota School of Nursing. I'm a product of the Army Student Nurse Program. So after I finished my baccalaureate degree in nursing way back when, I was on active duty in the U.S. Army for a while, working with burn patients, and got interested actually in futures thinking when I was a faculty member at the University of South Carolina and was tasked to create a leadership development program that would produce, quote, quote, visionary leaders. And at that point in time, I realized visionary leaders presupposed some notion about what the future would bring. So way back then, with the development of the Amy Cockcroft Leadership Development Program, we worked with the Institute for Alternative Futures to build curriculum for those nurse leaders in terms of influencing them about futures thinking, foresight, and policy development. And that red thread has actually been with me through time. I went on to the Indiana University School of Nursing and had several administrative positions there, and also was president of the Honor Society of Nursing, Sigma Theta Tau International, which is based in Indianapolis, but I was president of that organization from 2003 to 2005, and every president has a presidential call, and my presidential call was create the future through renewal. So futures thinking, foresight has always been a red thread in my academic and professional career.
Excellent. Let's talk about health innovation leadership. Obviously, this is an ongoing effort. Tell us how it got started and what you're trying to do here. Obviously, you're trying to bring innovation and foresight with it and futures thinking, healthcare in general, as well as nursing, even though our primary focus today is nursing. Obviously, there's importance throughout all of healthcare.
At the University of Minnesota School of Nursing, we have a Doctorate of Nursing Practice program in Health Innovation and Leadership. I think that was started like in around 2008, 2007. And the University of Minnesota has always been a pace setter and a pioneer in terms of innovation and leadership. I have an interesting quote here from Catherine Densford, who was the dean of the School of Nursing for 30 years, for which the center of which I direct, she is named after. And in 1948, she said this to a group of people at the American Nurses Association: "A profession in its thinking should be a generation or two ahead of the public. Keeping abreast of the world situation is not enough. At the same time, its position of leadership demands the nursing profession take on more and more responsibility for service, locally, nationally, and even internationally. My job as president has permitted me to travel widely and associate with nurses all over the world, and this broad experience has borne out my conviction that what any one of us does anywhere affects all of us everywhere. In nursing too, there is only one world." So that philosophy, that set of values and beliefs has permeated the curriculum development here at the University of Minnesota, and we have been leaders in data science, in gerontology, in pediatrics, in leadership. And so as part of that program, we've also have a post-baccalaureate certificate in healthcare innovation and design. And the students in a health innovation leadership DMP program take concurrently courses in that post-baccalaureate certificate to help them think more creatively about the impact and influence of emerging trends and consequences for the design and delivery of services in healthcare. It's a very popular program, and Ori is one of our alumni in that program. So maybe she could talk a little bit about what the DMP program meant for her and how the certificate program augmented her intelligence around foresight and futures thinking.
Ori, you want to elaborate?
Yeah, absolutely. So the university program at Minnesota is really allowed and has allowed nurses from all different specialties across healthcare to come into a leadership program that allows nurses from across healthcare to essentially learn fundamentals and principles of innovation and leadership and design. The curriculum itself is based off of design thinking. And in that space, how are they going to take that knowledge and then apply it to all of these individual areas of expertise across healthcare?
Excellent. So, Dan, if we go back to you, have you managed to make an impact with this on the nursing profession as a whole? Is it still an uphill battle? How's that going?
Well, as I mentioned, it was sort of my red thread. So I happen to be a fellow of the American Academy of Nursing, and they have a journal. It's called Nursing Outlook. And when I was inducted into that academy, I was committed to challenging people to think about the future. So I went to the editor of that journal and said, I think there needs to be some challenge and some stimuli among the membership about futures thinking in nursing so that we sensitize people to the importance and value of this foresight leadership. And I'd like to write an editorial about it. And Carol Anderson was the editor of the journal at that time. She was the dean at Ohio State. And she said, okay, she says, I'll give you 1 page. She said, do you think you could do something in 1 page? And I said, yes, I think I could probably do that. And so I created a column in this journal for this professional association called Future Think. And I ended up writing 36 of those columns over a 5-year period. And each one would talk a little bit about futures thinking and futures methodology, and then talk about an issue that would be pertinent to the nurses, like genetic literacy, like data science, like systems thinking. And so I wrote that column for 5 years, and I got a lot of great feedback from people that they really enjoyed that and appreciated the stimulation in regards to that column. And then as I mentioned, when I was president of the Honor Society of Nursing Sigma Theta Tau, my presidential call to action was create the future through renewal, and starting predominantly with nurses taking care of themselves so that they would be in a better position to take care of other people. And that got a lot of traction. And so I think we have contributed to the development of foresight leadership, but there is such a pull, I think, for people to be present-oriented or to be more past-oriented and try to fix the past rather than create the future, that there is this incredible tension. And there's a greater need, I think, to challenge people to develop foresight. So one of the things we've done here at the University of Minnesota to do that is we have created a LinkedIn group called Foresight Leadership. And I've curated some resources about foresight and futures thinking at the website www.foresight-leadership.org, and I continue my quest to challenge nurses to think about emerging trends and to figure out what the consequences and cross impact of those trends are going to be for nursing, for education, for practice, for service, for policy development. So we have now approximately 225 people in that Foresight Leadership group, and I'm hopeful that conversations will continue there, and we invite people to add resources to that group so that we can provide some resources for people to think about and use foresight thinking in the development of their curriculum, the delivery of their courses, and in the design and delivery of services that need to be revamped given the disruptive innovations that we have in healthcare. And Ori is a perfect example of someone who's taken the idea about foresight and innovation leadership as part of her Doctorate of Nursing Practice scholarly project. She created, invented, sponsored a workshop and worked with nurses. It was called Planting Seeds of Innovation. And it was a huge success, and we now have at the University of Minnesota offered that workshop every year for the last 5 years. Ori, is that right? We have the
Yep, that's
next
correct.
Planting Seeds of Innovation workshop's going to be February 27th, 2020, and we are on a quest to educate and produce nurses who are armed with foresight, leadership, knowledge, skills, and abilities.
Okay, in a little bit, we'll move on maybe to discuss some of those disruptive things going on that will affect the future of nursing, caregiving, healthcare in general. But let's get over to what Ori is doing, because as you're still very much in the training and academic area, Ori's out there as a practitioner of innovation. So talk about how you're applying some of this stuff, Ori.
Yeah, so I took all of that knowledge and experience and exposure at the University of Minnesota and have really been able to scale that across healthcare systems nationally. I have my own consulting business and have worked with a healthcare exclusive design firm. And in that space, working with healthcare leaders and healthcare professionals coast to coast. If you've heard of them in healthcare, I've probably been able to work with them. And essentially, how do we take that work that needs to happen in healthcare systems at the strategy level, and how do we incorporate design and innovation and then embed that into clinical operations or maybe the design of experience, and how do we use that work to then essentially say, yes, in healthcare we recognize that we have this, we have a depth of knowledge and experience, but that we need to take that and determine what our future trajectory is and how will that guide the work that we are leading moving forward. Because right now the healthcare industry is really struggling, and it's struggling because there are lots of shifting demands related to the environment, sustainability, shifting demographic trends around the country, which is impacting health systems, advancing technology, which we can talk about some of that moving forward, but also economic and policy uncertainty. And so in that place, we're seeing healthcare systems which when you think about the healthcare industry as a whole, it's almost like that engineering experiment where you're looking at air pressures and pressures on a can. And, when the change outside of an industry is happening more rapidly than the change that's happening within the industry itself, that's when you see that can collapse, right? That's that pressure that's acting on the system. And healthcare is feeling that crunch right now. And healthcare systems around our country are trying to figure out how to move from old models to new models. And our reimbursement structures are changing, which is requiring them to make changes very quickly. And how do they make change quickly when they're moving an entire health system? So in that space, healthcare is the largest employer, as far as the healthcare industry is the largest employer nationally. So when we think about our system and how do we expose healthcare professionals to new ideas, to come up with new ideas and concepts and ways to think about healthcare differently, innovation, design, and foresight, I think, are critical skills moving forward.
Let's talk about some of the disruptions out there, both short term and long term. To begin with, perhaps an almost global trend, particularly not just in the U.S., but even more so in some other developed Western countries, most extremely in Japan, where population is actually declining, is that birth rates have dropped below the replacement rate in most of the Western developed world. And of course, the developing world is catching up to that. They're dropping. And that means an aging population, even more so than we have now. And obviously, the demands on nursing and caregiving in general are going to elevate substantially. And I'm just wondering to what extent you have addressed that and what are some of the ideas you're looking at for the future to deal with the demand?
Well, I could take a stab at that from the academic perspective because I just read a projection last week that in 10 years, 25% of higher education institutions are going to be out of business. And that is because there are not the numbers of students being admitted to these programs because the demographics have shifted. And so that is serious in terms of the pipeline for the creation and development of future generations of nurses. We have a great nursing shortage now, but if there aren't people coming into the pipeline, then that is only likely to get worse. So you're seeing a lot of nursing education programs now looking at innovative ways to educate nurses. So for example, at the University of Minnesota, we have a professional master's degree program where we admit people who have baccalaureate degrees in other disciplines and other fields, and we put them through an intense 16-month accelerated pre-licensure program so that they can become RNs. So we're not getting the traditional 18 to 21-year-olds in our education programs now. We're getting people who have had careers as physiologists, as social workers, as occupational therapists, as nutritionists, and they are going to shift the nature of nursing into the future. And they are great assets and resources to the future workforce in that regard. So that's from the academic perspective. Ori might have some ideas from the clinical and service side perspective.
Yeah, Mark, I was thinking about kind of talking about Japan, and Japan is really interesting. They have the oldest population globally, and looking at how they are tackling their aging population. And with that, some of the interesting trends, in Japan are looking at when you think about a fashion runway in Milan and those models stomping down the runway, in Japan, they have fashion shows for adult diapers, right? And they are changing the perception of what it means to age. Their culture is changing that. And, and it's that marketing principle of that people don't want a mirror, they want a magnet, right? So in this space, we're seeing Denmark, launching these national advertising campaigns like Do It for Denmark, because they're seeing their shrinking populations. They're trying to encourage young families to have more children, and how is that impacting their society? And I think right now in this space where we have we're going to have a rapid influx of geriatric patients into our healthcare system, we are seeing new models emerge. So there's a great article in The Atlantic talking about how care is being delivered with mail carriers. And so in healthcare, we're really looking at how do we help people practice at the top of license? How can we engage in new care delivery models to help provide that care? So we're seeing, with population health models, we're seeing paramedics who are providing care in the community. So I think we're going to see more and more models that are very patient and community centric to help with that population. And in that space, care is really moving away from traditional healthcare systems, and it's moving to the community. It's moving to the home. It's moving to the communities where the majority of health actually takes place, and how, as healthcare systems, can we support that? And we're seeing that even with the change in the reimbursement structures in healthcare around how healthcare systems are not going to be paid on a fee for service or a volume metric anymore, that it's really about, are we ensuring that the patients who are a part of our healthcare system, are they maintaining their health even when they're not here? So we're going to see healthcare systems who are making larger and larger investments in new models to provide that care and allow people as they age to stay in their homes, to stay in their communities, because that's the social fabric and the network that helps support and maintain health.
And Japan is so far ahead of us in terms of technology and technological applications. So they're using robots to help nurses, but robots also as care guides and care support. They have got things like smart toilets where you sort of sit on a toilet and you get your weight. It will do your urinalysis. It will look for your colonoscopy. It will do your blood pressure. It will do all kinds of things. And so the marriage of technology with healthcare needs and sensors in the home to monitor and provide surveillance, as well as to remind people to do things. There's just amazing in terms of how that's being influenced by the accelerated use of technology to take care of older people in their homes.
I think this might be a good place to also interject a little discussion about gender roles. I had a podcast with Roberto Saracco of IEEE. He's an engineer, and in talking about autonomous systems and other things that IEEE was going, he also talked about the need to get more women involved in STEM, in the sciences and engineering. He said they're half the population of the world. We need that brain power. Well, you can kind of say the same thing in reverse with nursing. It's been almost exclusively a female occupation. Do you see any movement based on need or just recruiting, whatever, to actually get more men involved so that we get that half of the potential population?
Well, when I started in the nursing profession, 2% of people were men in nursing. This is way back in the mid-70s. I was a product of the Army Student Nurse Program, and 22% of the Army Nurse Corps at that time were males in nursing. Today, it hovers between 10 and 12% of the total population of nurses. But I'm pretty famous for a quote I developed once upon a time, that caring knows no gender. It is an equal opportunity verb. And so I'm all for more women getting into medical school. 50% now, I think, of medical students are women. There are more women in engineering, but there is an incredible blurring that's going on. For example, one of our students actually in our professional master's degree program is Kelly Landsman, and she has got a baccalaureate degree in medical engineering, and she is wanting to come into our master's program in nursing to marry those two. So there are an incredible number of people that are blending, and they're bringing in opposite or discordant qualities that were once upon a time separate. You now begin to see them being integrated and synthesized, and I think that is the nature of innovation and creativity. I heard a definition of creativity once that said it's novel associations that are useful. And I think that there's lots of opportunity for that. And I think there are lots of novel associations. It's not just gender, male, female anymore. There is an incredible movement around gender identity, sexual orientation, and the values and beliefs that society has in regards to respectfully including all people in those kinds of activities. What are your thoughts, Ori?
I think part of that blending and blurring that you're talking about, we're seeing in this space of healthcare professionals leading in design and innovation. And that blurring is allowing nurses to enter the fields of entrepreneurship, of business, of medical device design. So we are having people who are entering other fields that are traditionally male-oriented, right? And in that space, we are also, I just spoke with another nurse yesterday who is at the University of Minnesota who has already has an engineering degree. And she pursued nursing because she wanted to take that technical background that she had and apply it to people. And so in that space, we are seeing people from other industries and from those other STEM fields who are entering healthcare and they're entering nursing because they want that, they want to actually provide the care, and they're seeing as they enter this space how they can apply the work that they've already done to healthcare. And because, and the research shows that professionals who have a previous degree who enter healthcare or enter another profession, because of the amount of interconnections that they have, they're able to find new solutions. They're more creative. They have a broader network, and it's allowing them to create in their new field in new ways.
And I'll just add there is a great YouTube video that was produced by the Ripple Foundation. It's called The Adaptable Mind. And in that, they talk about not only talking about STEM, but they talk about STEAM. And they put an H in there because they think the humanities has been left out of the traditional science, technology, engineering, and math. And I think that that's an important piece of inclusion in terms of moving forward.
And in that space, we're seeing, traditional programs that are relaxing those test requirements to enter programs. We're seeing medical schools that are not requiring an MCAT before entry, that they're accepting and looking for people who have those humanities backgrounds, because people who are entering healthcare with a humanities background, specifically in medicine, those people who enter with that kind of a background are more likely to provide family practice community care, right? So in healthcare, we have lots of people who are specializing in individual areas, but one of the areas where we need the greatest number of resources are those communities that are, across the United States and rural America, and that's where we're seeing the greatest number of hospital closures. So since the early 2000s, there have already been, I think it was they started tracking these numbers back in 2005, but we've already had 155 hospital closures across the United States. And there was a phenomenal article in the Washington Post about a physician who is essentially on call 24/7 for his communities as he's trying to provide resources because there are no other resources. So how are we, again, moving resources to those communities and to those people who need the help?
Be sure to join me for part 2 of this program coming in a few days, when we'll discuss many of the specific challenges, trends, and disruptive technologies facing the future of caregiving. You can subscribe to Seeking Delphi on Apple Podcasts, Player FM, YouTube, or other outlets linked on the Seeking Delphi webpage. You can also follow Seeking Delphi on Facebook and me on Twitter. Your likes, reviews, and recommendations to friends are also always welcome. My technical assistant is Mohammed Maroof. Until next time, I'm Mark Sackler.